My name's Victoria Harris. This is my audience. Demi Moore once said, "I'm a big believer in that if you focus on good skincare, you really won't need a lot of makeup." I don't know about you, but I've come to realize that skincare and my complexion is very important. I've learned this at Peterson Dermatology. However, the disadvantage is that most people do not realize this until it is too late. Dermatology is a specialty in hair, skin, and nails. They treat many different things, ranging from skin cancer, which can consist of basal cell, squamous cell, and melanoma. This is from least aggressive to most aggressive. Then there is eczema, which is where skin patches are inflamed and itch. This can be very discomforting for patients and embarrassing. We see a lot of children affected by eczema. There is acne, which is seen most in teenagers. However, adults can even suffer from acne. There is hair loss, found both in men and women. Very embarrassing, and they usually want something done immediately. There is psoriasis, which is the red, scaly, itchy patches. This is something that I suffer from personally. It is usually found around areas such as the elbows, knees, and scalp, and I suffer from it on the scalp. There is warts, which can be all over the body, and we usually use beetle juice, which causes a blister and gets rid of the warts, or sometimes they are cut off. And then there's fungus of the nails or feet. Many procedures are done in dermatology, such as the Mohs procedure, which is a conservative surgery. It is done on basal cells and squamous cells of the ears, face, and neck. This procedure can take all day, up to all day. It is done by the patient coming in, being numbed with local anesthesia. The doctor will cut off the first layer, process it in the local lab that's at the office. If the margins are clear, the patient is ready to go home. If not, then another layer will have to be taken until the margins are clear. The advantage of this is that when the patient leaves, they know that all the skin cancer is gone. However, unfortunately, this can't be done on all skin cancers. For the melanomas or the squamous and basal cells that are not on the ear, face, and neck, an excision can be done. An excision is where you cut out a large area of the skin cancer, and then it is sent off to an outside lab, and we have to wait for the results to come back in. This is usually a disadvantage compared to most because the patient doesn't know if we've gotten all the skin cancer whenever they leave. Then there is the C&D procedure, known as a scrape and burn, that is done on superficial skin cancers. There is many cosmetic procedures that we do, such as Botox for wrinkles, sclerotherapy for spider veins, chemical peels for discoloration and sun damage. A lot of women like to get this done in order to get their complexion back to one color. The blue light is a procedure done for actinic keratosis and sun damage. Every patient reacts to this differently. It is usually done on the face, scalp, and arms. The incubation time for each of those is differently. The patient will come in and a medicine will be applied. Then they will have to wait for a certain amount of hours depending on the location of which is getting treated. And then they will actually be placed under the blue light for exactly 16 minutes and 40 seconds. For some, this is not painful at all. However, for others, it is very painful. You have to come in twice for this treatment, and then it is done. The patient range is from newborn all the way to adults. The high-risk patients, however, are those who have high exposure to the sun. This is me. When I was younger, I was at the beach and actually got a third-degree sunburn, and it damaged my shoulders and chest very badly. I had blisters, and now I have freckles and a lot of skin damage, so I have to be very careful in the sun. Then those who are fair-skinned, who have blue or green eyes, and I have blue eyes, those who have blonde or red hair, and those who are older. Glamour is about feeling good in your own skin, is what Zoe Zaldana said. We all deserve to feel good in the skin that we are in. So if you don't, it's time to go see a dermatologist today.